disease of addiction does not discriminate, even against those we trust to properly prescribe powerful drugs. Nurses, doctors, pharmacists, all of those people. Kylie McGivern analyzed 6 months' worth of disciplinary action reports centered around medical professionals in Tennessee. She discovered an alarming number involve overprescribing or addiction to narcotics.
Sarah, 5 out of the 8 most recent reports from the month of May involve prescription drug abuse. We're in your corner with how the problem is being monitored and what you can do to check out your prescriber. Over the course of 6 months, disciplinary action reports from medical professionals in the Tri-Cities region reveal everything from doctors having sex with patients they're prescribing narcotics, a registered nurse diverting painkillers for personal use for nearly a year before pleading guilty to DUI along with other drug charges, and a pharmacist continuing to fill a controlled substance prescription for a patient after the prescription was canceled and in large quantities.
We created a population that has become drug dependent.
Director of the Tennessee Pharmacists Recovery Network, Bettina Black, and Sarah Melton with ETSU's College of Pharmacy say that's because of a shift from not prescribing enough pain medications to now overprescribing.
There's no doubt about that this has contributed to the prescription drug abuse epidemic.
These people have become drug seekers because of their disease state, and that has resulted in prescribers, practitioners who have somewhat taken advantage of that situation for their own profit.
Both women say Tennessee's controlled substance monitoring database,
the use of it has really significantly increased in the past 2 to 3 years.
Has helped pinpoint and highlight the scope of a problem that has grown over time. For some, it's a lack of education.
What we're doing is taking 4-hour continuing education programs free of charge to these prescribers and talking about appropriate prescribing of controlled substances.
For other medical professionals, it's battling the disease of addiction themselves. But there is help available for these individuals to get into recovery programs and keep their medical license. One of the things they were telling me about this program is they do use the use of 12-step program, also drug monitoring. The TPRN's program director urges all healthcare providers, though, who are struggling with addiction to reach out for help. Now, some of you may be wondering about your pharmacist or your doctor or your prescriber. And what you can do is look at the same information that we did. You go onto the state health website and go to the license verification tab. And right there you can put the first and last name of your doctor, click submit, and all of their information will come up, including any disciplinary action that they may have faced. Sarah?